Okay, let me start with a brief but urgent and daily reminder to all Canadians. All of us must practice physical distancing. I know that it's really hard. Thank you everyone who is doing it. And please, let's all continue. Un rappel urgent et quotidien aux Canadiens et Canadiennes. Nous devons tous pratiquer la distanciation physique. One piece of good news. Today, the Prime Minister announced the appointment of Kirsten Hillman as Canada's ambassador to the United States. I have worked together with Kirsten since 2015, and I know that as we battle COVID-19 and have so much work to do with the U.S. on so many different issues, Kirsten is exactly the right woman to represent Canada in Washington. Congratulations, Kirsten. Okay, so today we are going to hear from Canada's Chief Public Health Officer, Dr. Tam. We're going to hear from the Minister of Employment, Workforce Development and Disability Inclusion, Carla Qualtrough, et notre Président du Conseil du Trésor, Jean-Yves Duclos. Dr. Tam, please.
Hello, everyone. So globally, there are now over 475,000 cases of COVID-19 affecting all countries. In Canada, as of this moment, there are 3,409 cases and 35 deaths. We have now tested over 158,000 people in Canada, which is more than 58,000 additional people tested since Monday. Ces derniers jours, de nombreuses provinces ont signalé une forte hausse des cas. Ceci résulte d'expositions qui se sont produites au cours des semaines précédentes. De plus, l'augmentation de la capacité des laboratoires, le fait que les laboratoires des hôpitaux sont en mesure de confirmer les cas ont contribué à une forte hausse au Québec cette semaine. Les cas sont liés à diverses expositions, qu'il s'agisse de voyageurs revenant de la semaine de relâche au Québec, ou de groupes de personnes qui ont assisté à des funérailles, faisant presque doubler le nombre de cas à Terre-Neuve hier. Large increases in cases have been reported over the past few days by several provinces, and these cases are emerging from exposures that occurred over previous weeks. As well, increased laboratory capacity and the ability of hospital laboratories to confirm cases contributed to a sharp spike in Quebec this week. Cases are related to a range of exposures from travellers returning from March break in Quebec to a large cluster linked to a funeral that almost doubled Newfoundland's case counts yesterday. We are now seeing a snapshot of the severity of COVID-19 in Canada, where 6.1%, so 6% of all cases require hospitalization, and 2.6% of all cases are critically ill, and 1% of cases have been fatal. The fact that Canada's fatality rate is at 1% indicates that the healthcare system is not currently overwhelmed, but these fatalities could be reduced further by preventing the illness in our most vulnerable populations. Many of the deaths in Canada have been linked to outbreaks in long-term care facilities in several provinces. The seriousness of this disease cannot be overstated. Older adults and those with medical conditions are at higher risk, but younger people are not immune. Not only can people of all ages get sick and become severely ill, but the impact on our health system will affect the health of all. People of all ages must heed the repeated advice of public health. Anyone unconvinced about the seriousness of COVID-19 and the absolute need for physical distancing should look to countries like Italy and the severe impacts of a health system overwhelmed. So by keeping a distance of 2 meters from someone else, you are protecting yourself and others. Thank you.
Well, thank you very much, Dr. Tam. Okay, now we're going to hear from our Minister of Employment, Workforce Development and Disability Inclusion, Carla Qualtrough. Carla, please.
Thank you. Hello, bonjour. Before I begin, I'd like to take the opportunity to thank the ASL and LSQ sign language interpreters who've been working hard to provide simultaneous translations during these very important press conferences so that all Canadians can stay informed. Thank you. Your work is very important and we appreciate it. Over the past few weeks, we've all been asked to work together to help stop the spread of COVID-19. I know that at times this has come with a lot of uncertainty, anxiety, and concern, especially about being able to pay your bills. La législation adoptée hier est un premier pas pour aider à soulager une partie de ce stress avec la mise en place de mesures spéciales pour soutenir les Canadiens qui sont en difficulté à cause de la pandémie de COVID-19. That is why, to provide urgent help, we've introduced the Emergency Response Benefit. From the very beginning, we wanted to help all workers, whether or not they were eligible for EI. We took the immediate action within the EI system by waiving the one-week period for EI sickness benefits. We then took action outside the EI system by announcing last week sickness and income support benefits for workers who are not eligible for EI. And then an unprecedented wave of EI applications came rolling in. And then it became clear that there was uncertainty and confusion around which benefit to apply for. À ce moment, il est devenu évident que nous devions simplifier les volets de prestations existants en une seule prestation d'urgence temporaire qui vise tout le monde. The reality is that our EI system was not designed to address a global pandemic situation. It doesn't help all workers, and it doesn't contemplate the myriad of situations that workers are facing during this public health crisis with its significant economic impacts. It's clear that we need an immediate emergency benefit outside of existing government program parameters to respond to this emergency situation. That's what the Canada Emergency Response Benefit is. Retroactive to March 15th, Canadian workers will have access to the CERB to a maximum of 16 weeks if their income loss is related to COVID-19. It's a streamlined benefit with a straightforward eligibility criteria. The portal for accessing the Canada Emergency Response Benefit will be available in early April, and until then, EI-eligible Canadians who have lost their jobs can continue to apply for EI online and will be automatically enrolled in the CERB. This automatic enrollment also includes all Canadians who have already applied for EI or EI sickness benefits since March 15th. We're truly doing everything in our power to help Canadians and protect them against this virus and its economic impacts. We'll continue to work together to find ways to support Canadian workers and their families. Merci. Thank you.
Okay, thank you very much, Carla. Et maintenant, je donne la parole au président du Conseil du Trésor et le vice-président du comité du cabinet sur le COVID-19. Jean-Yves, s'il vous plaît.
Merci, Chrystia. Le message principal aujourd'hui, c'est information et soutien. C'est informer des directives claires que nous devons tous suivre en termes de distanciation physique et sociale, mais aussi des directives très claires qui ont été à nouveau rappelées hier lorsque la loi sur la quarantaine a été invoquée pour s'assurer que tous et toutes qui reviennent au Canada se confinent durant au moins 15 jours dans des conditions correctes, sinon la loi va s'appliquer. Et la deuxième, c'est l'annonce hier de cette prestation canadienne d'urgence qui va aider les Canadiens à faire les bons choix. Et les bons choix pour éviter d'avoir à choisir entre protéger sa santé et s'assurer d'avoir du pain sur la table. Alors, on a annoncé hier la mise en place d'une prestation canadienne d'urgence qui est plus rapide, plus simple pour tout le monde, y compris pour le gouvernement, plus inclusive parce que cette prestation inclut tous les travailleurs et toutes les conditions de perte de revenus reliées à la COVID-19. Une prestation aussi plus généreuse de 2 000 $ imposables par mois pour les 4 prochains mois. Et ça, c'est parce que l'on veut éviter que les liens d'emploi entre les entreprises et les travailleurs se brisent. On veut éviter aussi que les gens doivent se retrouver à l'aide sociale. Et on veut faire en sorte que lorsque l'économie va reprendre, les entreprises puissent à nouveau payer leurs travailleurs rapidement en maintenant d'ici là le lien d'emploi.
Okay. Merci, Jean-Yves. And of course, with us also is Patty Hajdu, our Minister of Health, and our Deputy Chief Public Health Officer, Dr. Njoo. We're all ready to answer your questions, please.
OK. Alors, comme convenu, on prend 3 questions au téléphone, 1 question, 1 follow-up, and then we'll get back to the room. Opérateur.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. There will be a brief pause for the participants register. Il y aura un court délai vous permettant de vous enregistrer dans la file d'attente. Thank you for your patience. Merci de patienter. our first question, notre première question, is from Mia Rabson of the Canadian Press. Please go ahead. À vous la parole.
Hi, I'm wondering if you could talk a little bit about how the quarantine for people coming back to Canada will actually be enforced, what measures will actually be taken to enforce it, and how that might actually work.
Okay, Patty, and then maybe Dr. Tam.
Well, just in general, first of all, thank our hardworking public health officials who have been working so hard with their colleagues at the Canadian Border Services to put into place the measures that will help us enforce the Quarantine Act, that measures that we announced yesterday. Ultimately, what we are doing is reminding those Canadians who, and these are Canadians in the minority, I will say, who are not taking the need to self-isolate seriously when they return from international travel. And I will turn it to Dr. Tam to talk about the work she's been doing with the provinces and territories on enforcement.
So I'm just going to sort of take people back a little bit in imagining what happens when you enter the international border of Canada. So, of course, any symptomatic people will be immediately given an order to isolate. And if they have mild symptoms and they can actually go in their private vehicle and get home, we coordinate with local public health to make sure they're isolating. These are the ill people. If they can't get home, of course, we're putting them in a federal quarantine place. And of course, we'll also take into account a risk assessment as well. So if you're living with someone who happens to be older or with underlying medical conditions, that will be taken into account, so that we can house people separately from their family. So these are the symptomatic people. We have contact forms on them, we follow them, we make sure that we have a seamless process with local health authorities. For asymptomatic travelers, as they are now, they can move on as fast as possible to their home, essentially their place of residence in Canada. They are given the order, which specifies the kind of consequences and the penalties that you may encounter if you did not follow the order. They are allowed to go home. They're asymptomatic, and they're asked to self-isolate at home. For these people, we're doing random checks because there are many, many travelers coming across the border. And we will, of course, evaluate this method as we're going along. But that is felt to be the most reasonable approach. We'll also work with local public health. They have orders in place as well for self-isolation. So this is a coordinated effort. So if for whatever reason someone is not complying, we can then collaborate with local health authorities in the follow-up process.
Follow-up?
Yeah, and just to follow up on that, do you have any numbers on the number of Canadians who are in sort of, I don't want to call it the forced quarantine, but in the federal quarantine places? How many Canadians are actually being held in those places? And I think there's also some confusion nationally about what individuals can do to try and help. People are talking about so-called snitch lines, emails, calling police. What do you recommend to individuals if they know of somebody who's not following the order?
In terms of the numbers of people in our facility at the federal level, these are very dynamic numbers. They're very few, basically, at this point. For example, we do have someone who is sick in the Vancouver facility. We had just an example of a couple that went across the land border at the sort of Quebec land border, where they were not ill, but they were living with someone who is immunocompromised. So we would house them as well. We had a truck driver, for example, who is sick. So then that person is then immediately put into isolation. So these are the people who obviously maintain our essential services, but if they're sick, we're also making sure that they do not impact the health of Canadians. But they are right now a very, very few people, and some of these might already be, once we are sure they can safely move on to their homes, for example, with local public health, they will then depart. And so there's a very dynamic number. And your second question, so I think overall, though, I have to say that Canadians are very collaborative. This Quarantine Act is to layer on an additional message about the seriousness of self-isolation for people who've come back from overseas. So that is the purpose. Of course, if there are potential violations, we're working with local public health. And some of the easiest contacts, of course, people can have is with local public health authorities. But we work very closely with them to investigate anyone who may be violating the order. With those random checks, of course, we will also, from our end, potentially check on people who might also not be following the order. But, you know, as the ministers said, we are, of course, rapidly implementing all of this. We will adjust and change our strategy as needed, but it's really a collaborative response with local levels.
Thank you, Dr. Tam. Opérateur, une question en français au téléphone.
Oui. Notre prochaine question est de Hélène Buzetti de Le Devoir. À vous la parole.
Oui, bonjour. J'aimerais faire le suivi sur ces random checks-là. Comment s'assure-t-on, comment les fera-t-on? Est-ce qu'on va les faire par téléphone ou en personne? Et comment s'assure-t-on, si c'est par téléphone, que les gens ne nous mentent pas?
Voici, c'est Dr. Njoo. C'est sûr, on va obtenir l'information nécessaire des voyageurs qui arrivent au Canada. C'est pas tout le monde, mais c'est une sélection. Et puis après, on travaille étroitement avec les autorités sanitaires à l'échelle locale. On peut avoir une gamme des options. Peut-être quelqu'un peut visiter la maison, le domicile des voyageurs, mais on examine aussi des autres options. Donc, on a toutes les options on examine parce que le contexte peut être différent dans chaque province et territoire.
And maybe my follow-up is maybe for Ms. Hajdu, I'm not sure. I just want to know, for people who are coming back to Canada, they don't necessarily live in the same city where their plane has landed. I think there were talks about organizing transportations for those people who don't actually have their cars, their own personal cars at the airport. Have you sorted that out? How is it going to work, and where can people call to get that service?
Thank you for the question. The transportation is for symptomatic passengers so that they are not in contact with other Canadians on public transit that would obviously be at risk because of their potential infection with COVID-19. As the doctor has illustrated, asymptomatic passengers are given public health advice, including the order to quarantine when they get to their final destination, along with a mask, and told to don the mask should they become ill at any point of their onward travel.
But if they don't arrive in their own city, how do they do that?
The same way that all other passengers are traveling, they would get on to their next flight or whatever form of transportation is taking them to their final destination. And this would only be allowed if they are asymptomatic. If they were symptomatic, they would be transported by our officials and placed into one of our quarantine facilities until such time that we could determine that they were safe to travel onwards.
Just to add that the Public Health Agency has contracted medical transport. So these can actually go a certain distance. So depending on the situation, the ill passengers may either be transferred to a federal quarantine site, or if it's within our medical transportation distance, we will actually drive them all the way home.
Merci. Next question on the phone, please.
The next question is from Alex Bowlinghall from the Toronto Star. Please go ahead. À vous la parole.
Hi, thanks for taking my question. I think this one might be for the Deputy Prime Minister. Can you tell us anything more about the discussions with the Americans? There was this news report that they're contemplating putting troops at the border. Just what exactly that they're thinking about doing, and what our response is to that?
Thank you for the question, Alex. And the Prime Minister did address that in his daily press event this morning. I think for details of what the Americans are considering, the people to ask are the Americans. And the United States, of course, is a sovereign country, which does, as it ought to do, make its own independent decisions about what to do within its own borders. Having said that, let me share with Canadians what Canadian politicians, ministers have been expressing very forcefully, what our diplomats, including our newly appointed Ambassador Hillman, has been saying about this proposal. And that is that Canadians and Americans are rightly proud to share the world's longest unmilitarized border. This is an important example of how our countries very effectively work together. It is also the case that Canada and the United States are very close military allies. We are partners in NORAD, defending our continent, and we are partners in NATO. We have been working very effectively together in our economic relationship. Witness the ratification, even in these difficult times, of the new NAFTA. And last week, we managed, working collaboratively together, a very good reciprocal and cooperative agreement on restricting non-essential travel on our border, across our shared border. In view of all of these connections and the importance of the relationship, Canada is strongly opposed to this U.S. proposal, and we have made that opposition very, very clear to our American counterparts, and we will continue to do so. At the end of the day, every country takes its own decisions, but ours is an important and valued partnership, and we are making very clear Canada's position. Thanks.
Alex, one follow-up?
Yeah, thanks for that. And just, I guess, expanding on that, I mean, we're seeing around the world travel restrictions, lockdowns, borders shut down, countries sort of scrambling for supplies. Are you worried that the pandemic will sort of prompt a turn inwards, will increase the impulse to protectionism or cause countries to turn away from international cooperation?
Absolutely. And, when it comes to protectionism, I think we are already seeing that. I think we have to be thoughtful about the reaction. On one hand, every country in this time when we are facing real challenges to the health and safety of our own citizens, every country quite rightly needs to focus first and foremost on the health and safety of its own people. And that is what our government is doing. And we do that with no apology, in fact, with real conviction. Having said that, and I think Dr. Tam has been very effective at communicating this, at the end of the day, the reality of a global pandemic is that it is global. And the long-term lesson that we should be learning from all of this is how important international cooperation is. The lesson that we are being taught is that none of us in the world can be safe and healthy unless we are working hard to be sure that everyone in the world is safe and healthy. And that's why international cooperation is really important. Canada has been a country that from the inception of the rules-based international order has been a leader in that order. I think that we are going to reflect on this global pandemic as yet another lesson for all of us that we do need that international rules-based order. And that is Canada's position and will continue to be our position. The Prime Minister today participated in a call of G20 leaders, and that's an example of his leadership in the international response. Thank you.
Thank you, Minister. We'll turn to the room for 3 questions, starting with Mike from Global.
Thank you. Minister Hajdu, the PM said millions of pieces of PPE is coming into Canada. Where's it all coming from?
Well, thank you for the question, and I'll turn to Dr. Tam for some detailed level discussion about that. I know the Deputy Prime Minister has been working on the procurement file as well. Some of it is coming from China. Some of it is coming from other sources. As you know, we have domestic sources that we're trying to procure from as well. And I think to the Deputy Prime Minister's last comment, I reflect on the fact that this is a global pandemic, and one of the other things that I think this pandemic is teaching all countries is the fragility of our supply chain systems, and how when we rely on one country or another for a particular source of goods, and that is the only country that can provide those goods or in that volume, that it puts our capacity to respond in an emergency situation somewhat at a disadvantage. And so I know that the work that Minister Baines is doing with Minister Anand and I is critically important to meet what we may anticipate as a surge. But I am extremely proud of the collaborative efforts that are happening across government and with PHAC and with provinces and territories, quite frankly, to ensure that we can procure what we need. We're making progress on that file. Is it perfect? Not yet, but certainly I think we're getting a lot further in the last week or two than we have been in a while.
And so this is on top of this. China sent back about 16 tons last month of equipment, right? That's what I have here. But is this on top of that, or is that number totally crazy?
I'm sorry, what was the question at the beginning?
Can you confirm that China is sending back more medical equipment than the 16 tons sent back last month?
We'll have to get back to you on that. I'm not sure about those numbers, but unless Dr. Tam has details, but we'll get back to you on that. I will say that we appreciate how hard manufacturers across the globe are working right now to increase their production. And I would say we're not the only country that appreciates that. I, too, have regular calls with my counterparts, and we have a G7 meeting once a week. It happened to be today. Of course, all G7 countries right now are in the throes of their pandemic at various parts of their curve. And the question of personal protective equipment and other supplies was of paramount importance. And I will say that the efforts that are happening, as I said, on domestic production, but also on that sharing and balancing as we see the challenges emerge in different parts of the world is phenomenal at all levels.
Thank you. Julie Van Dusen, CBC.
Hi, Ms. Freeland. You say you don't like the proposal by the U.S. For the border. Don't you think we deserve to know what the specifics are? So could you just tell us what is the proposal, and is there anything we can do about it?
So again, the specifics of what the U.S. proposes to do within its own borders is truly a question which is rightly posed to American leaders. And I think that it would be inappropriate for anyone other than U.S. leaders to comment on what it is that they are contemplating. In terms of what we're doing about it, we are very directly and very forcefully expressing the view I shared a moment ago, which is that in Canada's view, this is an entirely unnecessary step, which we would view as damaging to our relationship. And I would also like to thank and acknowledge Minister Blair for speaking to his counterpart about this, and Minister Sajjan for speaking to his counterpart about this. Having said that, it is absolutely the right of every country, very much including our neighbor, to do what it chooses to do on its border. And I will also say that something that we have been in very close contact with our American counterparts about at the health level, at the border level, at the sort of political level, in explaining to them the actions that Canada is taking when it comes to public health here in Canada. Thanks.
Okay. I'm not sure if it's for Patty Hajdu or for Theresa Tam, but we are hearing, it's a health question, we're hearing that flight attendants are getting sick on planes because they have sick passengers that they're dealing with. Is there anything being done to stop this?
I'll start and then turn to Dr. Tam. We've worked with various industry sector partners to provide technical guidance for employees in that particular sector that can help them prevent acquiring COVID-19. We know that there are a variety of frontline workers, including retail workers, who are experiencing a higher degree of contact with individuals and not able to socially distance in the same way because their services would be considered essential. And so we continue to work with sectors to refine that guidance as we uncover various aspects of their work. And I will turn to Dr. Tam for any further comment on that.
Yes, so we do provide advice or guidance to different sectors and have been engaging with airlines on an ongoing basis. Some of the current measures being put in place, for example, ensuring no sick passengers gets on the plane, of course, also protects the crew that is on the plane. There are protocols on what to do with a sick passenger and ensuring that people have the right equipment in order to, for example, put a mask when on someone who's sick. That's the key piece, and try and separate them. Increasing environmental cleaning and procedures like that, providing advice to ensure that the aircraft is cleaned and safe as well. So, of course, anyone arriving in Canada who is ill will be taken care of, as with other travelers as well. But I think I understand the concerns, and it's really public health guidance that is being provided.
Okay, one last question for the room before we go back to the phone. Rachel Haynes, CTV.
Hi, Ministers. Rachel Haynes here from CTV. My first question is for Minister Hajdu and Dr. Tam. It's about a joint Canada-China research paper from the University of Calgary and 5 other universities in China that has shown that a 2-week quarantine may not be enough, and 1 out of 8 people will actually start showing symptoms after 2 weeks. So will Canada consider extending this quarantine to a 3-week period? Are there any circumstances under which this would be considered?
Given this is a research question, I'll turn to Dr. Tam.
I think we'll reevaluate new evidence as it becomes evident. I think we will certainly review this paper, but of course, there's always a distribution in terms of when, the incubation period of when people feel sick is still the most common, the median, if you like, incubation periods is still that 5 to 6 weeks. So you have to take 5 to 6 days, sorry. We have to take essentially a look at the range. So I think certainly different circumstances can be evaluated, but it's, the public health measures are layered, and you're perhaps never going to catch the tail end of that distribution curve. But our public health measures are there to essentially encompass the range of that incubation period. For all of those kind of papers, I have to sort of review whether how solid the epidemiologic investigation is, but we absolutely are open to integrating any new evidence.
And Minister Hajdu, as a follow-up to the previous question about the materials that were sent to China, when Canada sent this equipment, was there a reciprocal agreement already in place with China so that they would send us supplies when we are in our time of need? Were there assurances given by the Chinese government to send back these materials?
Again, I'll turn to Dr. Tam to talk about the principles of equipment sharing.
So I think at the beginning of the outbreak, of course, we are now in a very different moment in time in the pandemic, but I think the WHO called for global support to China. And I think it's a very important public health principle, which is containment at source is the most important thing one must do at the beginning of any outbreak, because by helping the initial epicenter, you're going to help the world. You're going to help Canada as well. So I think it's a reciprocal concept of, yes, helping China, but really in the end, it's preventing further spread, and that will also affect Canada and the rest of the world. So that's really the concept. I think that the global public health collaboration is extremely important, and particularly in pandemic circumstances. But if you want someone to contain that source, whether it's West Africa for Ebola outbreak or essentially Wuhan for the outbreak that initially impacted China first, that concept is critical.
Thank you, operator. We'll turn to the phone for 3 more questions.
Yes, thank you. The next question, la prochaine question est de Lina Dib de la presse canadienne. Please go ahead, la parole est à vous.
Oui, bonjour, Madame Freeland. J'aimerais revenir sur la question de la frontière et des intentions des Américains. Si vous voulez pas nous dire exactement quelles sont ces intentions, j'aimerais savoir si vous les prenez vraiment au sérieux, cette dernière idée de Donald Trump, et quel effet ça pourrait avoir sur le transport des marchandises, sur le supply chain dont on nous parle tellement.
Concernant la discussion autour de la possibilité que Washington va envoyer les gens militaires à la frontière canadienne, je dois souligner que on discute une possible décision du côté des Américains et c'est complètement inapproprié pour notre pays de parler des conversations internes à notre pays concernant une décision qui n'est pas encore prise. Ce n'est pas correct. Alors, pour savoir au niveau précis ce que les Américains sont en train de discuter entre eux à Washington, on doit vraiment parler directement aux Américains à Washington. Mais je veux être très claire parce que c'est important pour les Canadiens de savoir que la position de notre gouvernement, la position qui était déjà exprimée directement à nos voisins américains, est que cette proposition, cette idée d'envoyer les militaires à notre frontière, ce n'est pas nécessaire. La situation de santé publique ne nécessite pas cette action et que du côté canadien, nous pensons que ce sera pas approprié donnant les très cordiales relations entre nos deux pays, donnant l'alliance militaire qui existe entre nos deux pays. Concernant les possibles effets au commerce international entre nos deux pays, je dois souligner que la décision n'est pas encore prise, elle n'est pas annoncée, mais ce n'est pas la raison pour laquelle le Canada a pris une position si forte dans nos conversations avec les Américains. L'idée de peut-être envoyer les militaires à notre frontière, je peux vous assurer, je peux assurer les Canadiens que ce n'est pas parce qu'il y a une intention au côté américain d'empêcher le commerce international. Ce n'est pas une question du commerce. En même temps, la position du Canada est forte parce que nous pensons que au niveau symbolique et même au niveau philosophique, quand on parle des relations entre le Canada et les États-Unis, c'est important pour nous de vraiment avoir une frontière entre nos deux pays qui sont des voisins, qui sont des amis pour longtemps, de ne pas avoir une frontière militarisée.
Okay. Merci. Et si on tourne la question à l'envers, hier, vous n'en étiez pas là. Je vais vous redemander aujourd'hui, est-ce que vous en êtes encore à ne pas référer d'une quelconque autre façon le contrôle aux frontières, à la frontière, à cause de ce qui se passe dans l'État de New York, par exemple, et du grand nombre de cas aux États-Unis? Il n'y aura pas plus de contrôle à la frontière pour les marchandises, pour les camionneurs, par exemple?
On a déjà pris, incluant la décision importante annoncée pour notre ministre de la Santé, on a déjà pris des décisions fortes pour contrôler notre frontière, incluant la frontière avec les États-Unis. On a mis en place les restrictions contre les voyages qui ne sont pas essentiels. Je pense que tous les Canadiens comprennent que le commerce international entre le Canada et les États-Unis est absolument essentiel. Essentiel pour notre économie et essentiel pour notre vie. Les camions qui passent par la frontière sont les camions qui nous portent les choses à manger, qui nous portent les médicaments. Alors, préserver le commerce international entre le Canada et les États-Unis est très important et on a fait ça. En même temps, on a maintenant du contrôle des restrictions. Dr. Tam, il y a quelques minutes, a parlé d'un chauffeur d'un camion qui a eu des symptômes et la santé publique à prendre les mesures pour lui aider. Alors maintenant, nous avons des restrictions nécessaires, mais toujours chaque heure, on pense à la situation et on sera toujours prête à prendre toutes les mesures nécessaires pour protéger la santé et les vies des Canadiens et Canadiennes.
Très bien. Merci, Lina. Next question on the phone, please, operator.
Yes, the next question is from Paul Vieira from Wall Street Journal. Please go ahead.
Good afternoon. Can you hear me?
We sure can.
Okay, thank you. Deputy Prime Minister, can you tell us when U.S. officials came forward to tell you about this idea regarding troops near the border, please?
We first learned about the possibility a couple of days ago.
A couple of days ago. Okay.
A few days ago.
Have you spoken to Mr. Pompeo or Mr. Pence about this and relayed your opposition? You talked about the Defense Secretary and the Homeland Security Secretary, but have you spoken to anyone?
So, as I said, Canada has made its position very clear at a number of levels. Minister Blair has spoken to his counterpart. Minister Sajjan has spoken to his counterpart. Ambassador Hillman has had conversations at the State Department. We have had conversations with the White House, and I have had conversations directly with Americans about this, with American leaders about this. I have not yet spoken to Secretary Pompeo or Vice President Pence.
Thank you. Next question on the phone before we turn back to the room.
Oui, merci. The next question, la prochaine question, est de Philippe Vincent Poirier de Radio-Canada. Please go ahead. La parole est à vous.
Oui, bonjour, c'est Philippe Vincent Foisy. Question, juste revenir un peu sur les troupes. Vous avez parlé que ça pouvait, en anglais, endommager, être dommageable pour la relation canado-américaine. Qu'est-ce que vous voulez dire? Comment vous voyez ça dans le futur?
Je pense que j'ai déjà expliqué la position du Canada. C'est que nos relations avec les États-Unis sont très importantes pour le Canada. Je pense qu'ils sont très, très bonnes. Nous sommes des alliés militaires. Nous avons une forte et importante relation économique. Nous avons une étroite collaboration pratique à notre frontière. cette étroite collaboration était démontrée encore une fois la semaine passée quand on a pris une décision réciproque et très bien coordonnée concernant les restrictions dans les voyages qui ne sont pas essentiels à cause de la coronavirus. Et pour toutes ces raisons, pour nous, et nous avons exprimé ça directement à nos homologues américains, nous pensons qu'envoyer les militaires à la frontière n'est pas nécessaire et que ce sera un problème pour nos relations bilatérales.
Suivi, PV?
J'aimerais avoir une question de clarifier les choses là sur ceux qui reviennent au pays qui sont en quarantaine. On nous dit d'un côté qu'ils peuvent pas aller marcher même s'ils n'ont pas de symptômes. De l'autre, on dit ceux qui n'ont pas de symptômes peuvent aller marcher une fois qu'ils arrivent chez eux. Est-ce que vous pouvez juste comme nous faire étape par étape en français, qu'est-ce qui arrive avec quelqu'un qui rentre au pays, par exemple, qui arrive au pays dans son VR, qui va se rendre à Timmins, qui peut arrêter à l'épicerie, arrêter une mettre de l'essence. Comment ça fonctionne quotidiennement, cette mise en isolement obligatoire, une fois qu'on rentre au pays? Là?
Oui, bonjour, c'est Dr. Njoo. OK, comme Dr. Tam a constaté en anglais, je vais essayer en français. Pour tous les voyageurs qui arrivent à la frontière du Canada, on sépare parce que les voyageurs qui sont symptomatiques et les voyageurs qui sont asymptomatiques. Pour les voyageurs qui sont malades à la frontière, avec notre loi sur la mise en quarantaine, il y a toujours l'aspect qu'il faut avoir une évaluation et si vraiment quelqu'un a besoin de traitement médical immédiat, on va faire une suivi pour envoyer à un hôpital. Dans le cas de COVID-19, si quelqu'un est un peu malade avec quelques symptômes, on donne tout de suite une pamphlet avec des instructions, avec une ordre, et c'est nécessaire d'aller tout de suite à la maison et se mettre en isolement. Ça, c'est clair pour les personnes qui sont symptomatiques. Je pense que votre question, c'est pour les personnes asymptomatiques. Donc, on dit aussi, on donne aussi une ordre et aussi c'est obligatoire pour se mettre en isolement pour 14 jours, mais c'est différent parce que les gens s'ils arrivent et à la frontière avec les États-Unis, c'est correct si on a une voiture pour aller directement à la maison. En principe, c'est vraiment sans arrêt, mais c'est possible que peut-être quelqu'un doit arrêter pour les besoins. Si on évite, on utilise toujours les principes on dit éloignement physique, c'est correct, mais non, on recommande. C'est pas une bonne idée d'arrêter, faire l'épicerie, acheter de la nourriture. C'est mieux d'aller tout de suite à la maison et puis on peut toujours demander à un ami, une voisine, la famille, acheter des choses, la nourriture pour les voyageurs qui arrivent à la frontière. Pour les autres qui arrivent aux aéroports, c'est le même principe. Si on est asymptomatique, on donne aussi une ordre et on donne aussi une masque si c'est nécessaire, si quelqu'un développe des symptômes. Et c'est important pour ces 7 personnes aussi de prendre le prochain vol et quand ils arrivent à leur ville ou à l'autre aéroport, aussi prendre la transportation pour aller tout de suite à leur maison. Pour la question d'exercice, vraiment, on voit que les voyageurs qui arrivent au Canada, leur risque, leur possible exposition au virus à l'étranger, c'est différent que les Canadiens ici, déjà à l'intérieur du Canada. Donc, on dit que c'est vraiment une situation spéciale. Et on dit oui, c'est possible. Si tout le monde a besoin de l'air fraîche, oui, on peut sortir, aller sur le balcon, tout ça. Mais en principe, oui, si on prend une petite marche peut-être autour du jardin, quelque chose comme ça, c'est correct, mais pas vraiment être en contact avec la population générale. Je pense que c'est assez de précision.
Thank you, Doctor. So we'll take 2 questions from the room, and then we'll go back to the phone for 2 more questions, and that's it. Kelsey Johnson Reuters.
Minister Hajdu or maybe Dr. Tam. We're hearing from the companies that make ventilators that it would be much easier for them if there was a more streamlined process to deal with requests for orders, distribution, and perhaps even managed distribution. Is there a consideration to have a single entity, maybe FAC, take over this rather than having companies field 15 or 16 orders from various provinces or various regions and not know where to send them?
Thank you. That's exactly what is happening. We are coordinating by and large with the provinces and territories to mass procure all of the items that we need. There are still some provinces that are putting in individual orders, but we have encouraged them to work with us in this procurement process to help streamline and facilitate those orders, and also to be able to put in the bulk orders that will receive hopefully more attention in competitive space with other other orders from other countries. That work continues though, and as I said, Minister Anand is helping Public Health Agency of Canada and Health Canada to make sure that we streamline as much as possible, not just the quantity that we need, but also the specifications that are being required.
Okay. And then my second question, I believe, will be for Minister Qualtrough, but it may be Minister Duclos, so correct me if I'm wrong. I'm wondering what is the portal company that the Canadian government is using to actually administer the program? It's not the same company that did Phoenix, I'm assuming.
I thank you for your question. The portal will be administered through the Canada Revenue Agency. We've done a deep dive on our systems within the Government of Canada, and Canadians are confident in and know that the CRA can deliver. All of your taxes are paid through CRA, payments are made through CRA, Canada Child Benefit, GST credit, your tax refunds. That's all through the CRA. They have a massive capacity to administer bulk applications very streamlined and confidently, and that's the security we were looking for, and that's why it will be delivered through CRA.
Thank you. No questions? Well then, Julie Van Dusen, CBC.
So, Ms. Freeland, just so I can understand this, they want to put troops along the border to stop COVID from going into the States. Is that it? Is that why they want to do it? That's not my full question, but I'm assuming that's it. So you can tell me if that's not it. But anyway, I'm assuming that's it. So wouldn't it be incumbent upon you to step up screening of the people they're sending over, truckers or otherwise, especially coming from a country where the virus is spreading so quickly?
So look, Julie, in terms of the ideas that are currently being discussed within the U.S. administration, our understanding is that a decision has not yet been acted upon or fully taken. Having said that, decisions are being taken at speed by governments around the world, and including ours, including others. And so it truly is both difficult and inappropriate for me to specify what is being discussed inside another government. And I can say, from our own experience, everyone right now in the whole world is operating on the principle of choose speed over perfection. And it means things are being done fast. They're being discussed quickly. It also means ideas change a lot. And so that's why I really understand the desire of reporters and of Canadians to know, precisely what is being discussed. And it is simply impossible for me to offer that precision, partly because this is not something that we are doing, but also because, quite understandably, this is something which is in the process of being discussed. And so that is why I can't offer precision. Directionally, though, as I understand it, the notion is around a need which all countries, I think, today are seeing, and including Canada, which is to have greater control at our borders at a time when there is a global pandemic. And that is something which our American neighbors are also conscious of when it comes to their own borders. And in fact, it is that shared view which was the driver of the reciprocal and coordinated decision that we took with our American neighbors about the border last week. So that's kind of as much as I can tell you around the conversations that are happening. And maybe just to elaborate a little bit more, the point that we have absolutely made is we understand the concerns about the coronavirus. We share those concerns very much. I hope everyone listened to Dr. Tam when she said to all of us, take this seriously. Look at what has happened in Italy. I certainly sat up a little bit straighter when she said that. This is a serious thing. We all need to take serious action, and we are. So we understand the seriousness of the issue. We understand the concern of our American neighbors and friends. What we have said is we really do not believe at all that there would be a public health justification for you to take this action. Of course, it's up to you to decide for yourselves. And we've said we really don't think this is the right way to treat a trusted friend and a military ally. So that's been Canada's position. In terms of our position with regards to our own border, we have taken action, and it is entirely appropriate to have more restrictions at all of our borders, very much including our border with the United States. And we have taken measures that Minister Hajdu and Dr. Tam have been talking about today and yesterday to have mandatory quarantine for everyone entering Canada, including from the United States. Those are appropriate measures at this time. Those are serious and stringent measures, and we are constantly reviewing the situation to see if further action needs to be taken. We do when it comes to things like truckers crossing the border, and I do really, first of all, I want to thank them for doing that essential work, and I want to underscore to Canadians that all of us every single day depend on that cross-border commerce continuing. We depend on that cross-border commerce for our shop shelves being stocked. We depend on it for crucial medical supplies and equipment. And just as within our own country, we are taking particular steps when it comes to essential workers, the same approach does and must apply at the border. Thanks.
Okay, thank you. 2 more questions on the phone, please.
Yes, thank you. The next question, la prochaine question, est de Michel Lamarche de TVA Nouvelle. Please go ahead. La parole est à vous.
Oui, bonjour. La question est pour Monsieur Duclos. Monsieur Duclos, j'aimerais vous entendre sur cette idée que le premier ministre a abordée ce matin de demander aux banques de réduire les taux d'intérêt des cartes de crédit parce qu'on sait qu'on avait déjà un gros problème d'endettement des ménages au Canada. Pouvez-vous nous dire à quoi ressemble ce plan-là sur lequel vous travaillez avec les banques? Quelle est votre proposition aux banques?
Merci de la question. 2 choses là-dessus. La première, qui est connue depuis un certain temps, c'est que les banques au Canada, et ça inclut le mouvement Desjardins au Québec, se sont engagés à faire tout ce qu'il faut pour retarder à la fois les paiements d'intérêts et les versements de capital hypothécaire au cours des 6 prochains mois. Les banques et le mouvement Desjardins se sont aussi engagés à travailler avec leurs clients pour assouplir les conditions de paiement des autres types de prêts, y compris les prêts qui passent par les cartes de crédit. Et ça implique aussi un engagement de leur part à faire en sorte que certaines modalités pour réduire les taux d'intérêt sur certains des prêts que les gens ont, entre autres ceux sur les cartes de crédit, donc que certaines modalités soient offertes aux clients, par exemple pour prendre des fonds sur des cartes de crédit qui génèrent des intérêts importants et pour les mettre dans d'autres types de prêts auxquels les clients des banques et du mouvement Desjardins pourraient avoir accès.
Monsieur Duclos, ça ne répond pas du tout à la question. Je veux savoir sur quoi vous travaillez avec les banques, au-delà de ce qui a déjà été annoncé. Quand on parle d'un taux d'intérêt qui serait, disons, plus raisonnable pour les gens qui subissent énormément de pression financière. Est-ce que vous avez une idée en tête? Est-ce qu'il y a un plan précis? Parce que là, on dirait qu'il n'y a rien là, comme proposition.
Bien, la proposition, c'est ce que je viens de vous dire, Michel, c'est que les banques et le mouvement des jardins se sont engagés à la fois sur le plan hypothécaire et sur le plan non hypothécaire pour faciliter la vie des Québécois et des Canadiens au cours des prochains mois. Sur le plan hypothécaire, l'engagement est clair, c'est de reporter à la demande des gens les paiements d'intérêts et de capital pour les 6 prochains mois. Sur les autres prêts, incluant les paiements sur les cartes de crédit, les banques et le mouvement des jardins se sont engagés à démontrer la souplesse, la responsabilité sociale incluse que les banques et le mouvement des jardins doivent démontrer dans des moments très difficiles pour des centaines de milliers, sinon des millions de Canadiens.
Merci. Dernière question au téléphone, s'il vous plaît, puis ensuite...
Yes, thank you, merci. Our next question, la prochaine question, est de Abigail Bimman de Global News. Please go ahead, your line is open.
Hi, thanks for taking my question. I heard earlier from Dr. Tam that the number of Canadians that you are planning for to arrange quarantine facilities for is obviously in flux and not so many so far. But I'm wondering if you can elaborate on how many you're planning for. Are we talking about thousands, more than that? And I know I heard from Minister Hajdu that hotels were involved yesterday. Are there other kinds of facilities that you're engaging?
Well, in the sort of Quarantine Act, we can actually take over specific sites as a federal quarantine site. Some of them really have been hotels, and so that's very key. And we thank the collaboration that we have, but it is something that can be done. It is done through the Quarantine Act. We, of course, also have plans B or C looking at other sites, including, for example, Trenton has been used for other repatriation flights. So looking at federal sites, facilities, there are different ranges of those. So I think we're expanding to just examining all the options, should they ever be required.
One follow-up?
Well, yes, you didn't answer my question in terms of how many people you're planning for, but I'm also wondering if you can, and I know we've heard some of this in French, but if you can again elaborate on the follow-up from public health in terms of following up with travelers by phone or in person, and what happens when it actually comes to enforcement? Is CBSA involved? Is that local police? If you could just paint that picture a little more clearly, please. Thank you.
So anyone who's sick is immediately isolated if they can't go directly home and they're mildly ill. If they're seriously ill, they go to the hospital, they're isolated. A quarantine order is put on them. We, of course, follow them in collaboration with local public health. Asymptomatic passengers, again, are given an order to self-isolate, go directly as fast as possible to your home. And we will do random checks on the asymptomatic people. And that can be done in different ways. So telephone call. Of course, we collaborate with local public health as well, some of whom have also got mandatory orders to self-isolate. If, for example, you didn't find someone at home, well, we can also collaborate with local public health because it's also within their interest that they know what's happened to a certain resident in their jurisdiction. So that's what we would do first. Of course, the Quarantine Act has hefty penalties. If someone is actually violating the Quarantine Act, we can go to the further step to execute those fines or the penalties. And that hopefully will not happen very frequently. That is what we are looking for. But under the Quarantine Act, we can engage potentially peace officers if needed. But again, it's more, this is a deterrent, if you like, a serious reminder of how absolutely important it is to undergo self-isolation. And so that's how we envisage the act to, or the orders to roll out.
All right. Merci beaucoup. Thank you.